These things make us feel small and defeated. We wonder if anything will ever change. Today, as city manager, I want to say yes, they will.
The city manager announced what she calls the nation's first joint pediatric and adult hospital-based violence intervention program.
Each year, hundreds of individuals, children and adults alike in our city, arrive at our hospitals with the physical scars of violence. And we refuse to continue to meet them with just bandages. Instead, the city is committed to meet them with compassion, understanding, and a commitment to breaking the cycle of trauma.
The city, UC Health, and Children's will provide wraparound services for gunshot victims and their families.
Re-injury rates are soaring as high as 45%, highlighting the urgent need for comprehensive support beyond the initial treatment of gunshot injuries.
That support will be provided by violence prevention specialists hired for the ERs.
You come through the doors as a victim of violence, you're met by one of those violence prevention professionals, and they work with you to understand what you might need.
Mental health and substance abuse support and access to community resources. The money for the program is coming from a $600,000 violence prevention grant, a grant community-based programs were vying for.
What about all of the community-based programs? They're not going to get any of that money?
The community partners that you just referenced, the city has definitely had an opportunity for them and are happy to have them working with us, alongside us.
The city manager also mentioned the roughly $3 million it has through its human services budget and other community grant projects. We asked a couple of those community groups about the direction the city is going.
So you're fine with this $600,000 going to UC Health and Children's?
I'm ecstatic, because I know what it's going to do.
Consultant for the city manager, Iris Rowley, says the city is very much on the right track.
David Winter, I think we've been on the front line collectively together for the past 20-something years. And every year it gets worse. We cannot just police our way out of this. All hands are on deck.
Now, the hospitals say that they plan to hire 2 to 3 violence prevention specialists and get the program kicked off by the summer, just before gun violence season begins.
You can always find our stories here on YouTube, but go ahead and click subscribe to get notifications and stay in the know.